So again, obviously, for this presentation, my name is not up there because I am not part of the original group for this. So this was kind of looking at what up and coming things are happening right now for emergency medicine. So what are kind of changing the way we advise students? What are new issues that we need to discuss in regard to advising students? This is actually Nicole Dubois, Doug Franzen, and Jules, who you met earlier, presented this at CORD. So I'm going to go through it. So obviously there's been a lot of changes with the landscape. The last couple of years we've had COPA statements in regard to away rotations, and this year there's no statement. They have moved on. So there was a consensus statement that came out from several of the emergency medicine groups that I'll show you a little later. Step one is going pass-fail, so you're going to have some students who took step one are going to have a 3-digit score. You're going to have some students that are going to have a pass-fail score. We're going to talk a little bit about preference signaling, virtual versus in-person interviews. We don't know yet. Again, maybe some mixture of it. Again, it depends on your perspective if you're in favor of it or not. A little bit on workforce, because I think we have not at our shop seen a change, but I do think the numbers that we saw last year for open slots and applying to emergency medicine was definitely affected by that. And then how to get access to some of the underrepresented medicine scholarships. So this is their, it seemed like it was a wild, wild west out there now where there's no guidance from COPA saying, hey, apply to as many places you want, go on as many interviews or many away rotations as you want, and we said, hey, wait a minute here. There's not enough rotations for everybody to do as many rotations as they want to. So like I said, there's a consensus statement that came out through CDEM, through SAEM, EMRA, and RAMS, that saying that students should only have 2 EM rotations. So you have your home rotation and then your 1 away rotation. With that goal of trying to get two slows basically. Now again, if you're doing an ultrasound rotation, I think that's kind of that plus for kind of that O slow or the other slow. But these are trying to really focus in on 2 clinical EM rotations. Now obviously there's some special circumstances. Military, that might be because they have to do a rotation at military. So you may consider them doing your home institution, maybe the military, and then maybe another one. So they may end up having 3 slows. No home rotation, so those kind of orphan programs that you've heard that terminology used. So they may need to do 2 true away rotations because they don't have the opportunity at their spot. Students that are in other special circumstances, they had to do a gap year for whatever reason. They took a leave of absence because of family issues or personal issues, and so they may need to do an additional one. I had another student. I think, in all honesty, I had probably 1 or 2 students that were actually advised, even prior to any of this, to do a 3rd rotation. It was like a student who rotated with us. It was like a straight pass, rotated with us, got passed, like, oh, God. Then did another one. It was like, okay, a little bit better. You got a high pass. And so, again, I was kind of like, let's get, let them do 1 more rotation. And I have the privilege of actually having, or the opportunity of actually having kind of quote-unquote 3 home rotations, because we have our main camps at University of Michigan. We have a site up at Hurley and Flint. And then Henry Ford, we have a relationship with them as well, and so students will go do. So they kind of did 3 within our system, but they were able to fit them all in. So again, that's the only time I've really said, you should think about doing 3. So really kind of thinking of who should be doing a 3rd rotation versus, again, just trying to stick it to the 2 rotations. So this data is a little bit old. Now I guess this year, I don't know how everybody else is, but I've seen like the number of applications for away rotations is actually really down. And again, that could go to the workforce part that we'll talk about a little bit later. But and then when I offer slots, usually as I offer a slot and the student accepts it and we're all great, this time it's taken me like 5 offers to get anybody to actually accept it. So again, I think because of the changing landscape, less people are applying to away rotations, so people are actually getting multiple offers. So again, that's something else that kind of have to see how it shakes out, sort of thing. So again, this is old data. This is all pre-COVID. So on average, there's about 1.5 away rotations available for students applying to emergency medicine, and variations on graphical location and time of year. But again, this year, this seems like this, again, like I said, old data may actually not be a part of it. Now, we've already talked about it once or twice already, step 1, going pass-fail. So this is some of the data that's kind of come out of that. So 65% of programs use step 1 to screen applicants. They roughly had, cut off 200, 210, 220 versus that we just review everybody. It doesn't matter what your step one score is, as long as you pass. Now, EMRA Match currently shows that, again, this is old data, 125 out of 267 programs actually had no step one cutoff. Now, this looks a little bit more, a survey of 121 EM programs about going pass-fail. Most of them, 88.4%, said that I'm just going to basically more or less shift the weight that I put on step one, and it's all going to go on to step two. And then 85% actually require a step two score in with errors for applications. So again, it's really kind of pushed that timetable up for doing, because again, when I started doing this, it was like, yeah, as long as you take it by, you match day. And then it became like, yeah, as long as you take it by the time rank lists are due, because programs want to make sure that you actually pass step two before they actually rank you. And then now it's become, okay, now you get to get a step two score in by the time you do your ARIS application. So it's kind of where we're at with things. And then preference signaling. So has everybody heard of preference signaling? No? Okay. So this was originally piloted, I think it was in, ENT, I think is where it started out. And it's basically, you get, a couple of tokens, I think they use like 5 tokens, and it's a way of kind of notifying programs like, hey, I really like you. Hey, I'm really interested. I mean, for lack of a better description, it's like, hey, I'm really interested in you. Now, again, like, the data from that is kind of mixed. It definitely seems like for the students that are going to do well, the preference signaling probably didn't really make a difference. Like Adam's example, I mean, if you're a 250 on your step one, 260 on your step two, you have some great invention and publish 20 papers, preference signaling is not going to really make a difference. What they saw that made a difference is those kind of the average to lower performing students. The ones that kind of get lost in the application pool, the ones that you kind of look at and say, okay, I'm going to put you in this, I'm not going to reject you yet, but I'll maybe look at you a little bit later, that may or may not actually get to. So those students, like I said, that's where it seemed to affect them the most, or it helped them out the most. Now again, how we use the tokens, who should you send them out to? Again, there's kind of mixed on recommendations for that. And there's actually a talk, I put it, or a webinar on Thursday that everybody should have got an email. It came out through Cord in regards to that. And if not, if you didn't get the email, let me know and I can forward it on to people. I unfortunately can't attend because it's the same time as the Medical Student Symposium, so I will be talking to students at that time. But so what some recommendations was, you should have, send maybe 1 or 2 to like your safer programs, just so they know that you're interested in them. And then maybe send, a couple to your, I'm really interested in you, and then a couple to you, I'm really interested in you, but I probably am not at your level, like those REACH programs. And then some people said, no, just send them to the safer program. So again, there's lots of variations for advising for who to send those out for. So it looks like for emergency medicine, there'll be 5 tokens that you can use out. And don't need to send one. Right? Current thought is don't send one to your home institution, and don't send them to a place you've done away rotations. Because the thought is they already know who you are, they've already met you, they've already talked with you, so again, you already stand out compared to someone who they don't know, have never met before. There's other parts of the preference signaling that other institutions have used, like geographic preference signaling, supplemental application, where you write and more or less you rewrite your ARIS application for a 3rd time, saying, hey, here's where I stand out. Emergency medicine has chosen not to participate in those areas, but that preference signaling is one that's coming out, and we've have agreed to do. I understand there's more and more institutions are going into, or more and more specialties are doing a very similar. But again, this is kind of considered a pilot year for us. And then the interview format. So I've talked to some people, and I think people still don't know what it's going to be. Is it going to be virtual? And I think, again, from the program standpoint, a lot of people I've talked to, they want to see the student, they want to meet the student, they want the student to know what they're coming into, the location, what their hospital looks like. From the student perspective, I've heard, but then I don't have to travel if we do it virtually, and I can do 3 interviews on one day, depending on the time of it, so I can actually interview at more programs. So again, there's that push and pull a little bit. Then there's also the second visit that people have talked about. So we're going to have it where we're going to offer you for an interview, and then if you really want to or are interested in us, here's a day that you can come, visit us at our institution, and we'll have, often it'll be, meet with a bunch of residents and some faculty. You get your typical tour, that sort of thing. But then it comes down to so if I decide not to do that, does that mean that you think I don't like you? It's like high school. It's actually worse than high school. So again, that maybe we're going to go to these second visits, maybe not. Last year they talked about maybe doing it, and then they talked about not doing it. So I think we're still kind of up in the air. So I've told students, like, I just don't know what it is. I think, be prepared that you're going to have to go on all these trips if we go to in person, because I think it's easier doing that and then saying, oh, just kidding, we don't go on any trips, versus the plan on not going on trips and then have to, save up the funds and whatever else for it. But again, I think it's still kind of unknown at this time. And again, COVID numbers going back up, who knows what institutions are going to do. So again, they did a survey of some program leadership. 26% wanted virtual interviews only, and then you've got 20% who wanted to offer virtual and in-person interviews with applicants choosing the format they prefer. So again, letting the students choose, like, do you want to come in person versus you want to do it virtually? And then, like I said, 37% talked about the virtual interview and that optional second look weekend. But again, I think it's, a lot of these are, going to not necessarily help the student anxiety, because now it's like, okay, well, now there's 4 different programs, all have their second look on the same weekend. Which one do I go to, sort of thing, and how's it going to look if I don't? And then, this is another one. So the workforce projections. So again, I kind of talk about this a little bit. So I definitely have seen my number of applications. I open up my slide, or open up one of my Excel sheets, and there's like 60 students on there. It's like, oh God, there's a lot more students. Like, oh wait, no, that's for last year. Where it really has gone from like, almost 60 students applying for away rotation. So I think this year, even for, I think through October, I think I have less than 20 students that are actually sent applications. And again, maybe just because they don't like Michigan. It's cold, it's snowy, that sort of thing. But again, that's unusual from the past. Now, some of the things that I talk about is, this workforce is, who knows what it's going to look like now with COVID. We saw a lot of faculty, we saw definitely people leave early, early retirement, transition to non-clinical positions. So are there going to be more positions they're going to be opening to? So one thing that we did last year for our students to try to, be very open and discuss with them as a group is, so we had a talk and invited, students from those that were applying to last year, so those that already had decided on EM, all the way to the students who were literally in med school for 2 months at that point, who might be interested in EM, and just try to have a very open and frank conversation with them. And really, it was we don't really know what this data actually means. But then our big focus on it is we actually talked about, so how do you get it so you stand out though? How can you craft a career that if you're applying for jobs later on, it's like, oh, you're one of the few people that does this. I want you here, versus the person who I went through, like me. When I went through medical school, I didn't have anything to stand out. I did residency. I wasn't going to do anything different. So again, how when I apply for jobs, are you going to stand out? So are you going to focus on administrative? Are you going to focus on education? Are you going to try to focus on research? Are you going to? So we actually were able to get alumni from different areas throughout the country, so they can kind of represent how it is in their location. Different, except focuses of their career, so they can kind of talk about how they got into that career, what their career looks like. So that's how we are dealing with some of the concerns about workforce. So. Like I said, we specifically have not seen the numbers drop off for numbers that are interested in emergency medicine. But again, just looking at the 1 year, a lot of the students already had decided on EM even before this all happened. So it'd be interesting to see kind of what happens with this year. And then again, I think most people kind of have seen this data already. So we went from having no open slots on, less than 10 open slots on SOAP day to having 100 spots open on SOAP day. So that one student who I said, you might need to consider dual applying, I was wrong. Their response was, I'll just apply to 100 more programs. Like, okay, but when they got their 5 interviews and then a matching, I'm happy for them, but in a typical year it may not have happened. So again, making advising a little more difficult on what it's going to look like is is it going to look the same thing as next year as it does now? Is it going to look worse next year as it does now? And so I don't know. So not that I've had any answers to any of this that I've talked about, just kind of things that we need to think about when we're advising some of these up and coming changes that are going on. The other thing that, this is a little bit of a side, so a lot of people may or may not be aware of, so there are, through CDEM, a list of underrepresented minority scholarships that are available for their students. So I know when I get all those emails, I basically just forward them on to the students so they are aware of them and look through them. There is a centralized repository for these. Now, admittedly, just like everything else, it's not always updated. But if you guys have rotations that you want to be able to advertise, like I said, if you go to this CDEM site on SAEM, there's a link that you can add programs to that. So, what questions do people have? Anything? All right, Luann, if you want to come on up. So we've talked about the LCME a little bit already, so Luann's going to talk a little bit more about it, and especially from her perspective in the Dean's office.